Okay, we're on the lower extremity, the anterior aspect of the thigh. Okay, the muscle we're going to look at next is the sartorius, considered the longest muscle in the body. Okay, it does go from the hip down to the knee, so it crosses two joints, the hip joint and the knee. The origin is the ASIS, the anterior superior iliac spine, and the insertion is down on the medial aspect of the tibial tuberosity. Okay, its action, it will help with flexion at the hip, and then abduction, so abduction, and external rotation. So the action, to simply visualize it, is picture you're sitting down and you want to cross your leg, okay, kind of the figure 4 style, right? So you bring your leg up, that knee goes out, you put your ankle on your opposite lower, distal thigh and knee area, okay, crossing your legs. So that action is a pretty good representation of what the sartorius helps you do. It's also worth noting that clinically, this muscle can give a person some hip pain and knee pain, and the main reason is because most people have a pelvic unleveling, so the hips should be straight across, but in some people the hip is one hip is higher than the other. Okay, so this hip is higher, that hip is lower, or it could go the other way, meaning okay, this hip is higher or that hip is lower. But because of that pelvic unleveling and the running and the CrossFit and all the stuff people do, it can cause hip flexor pain and knee pain. So when we evaluate people, we're looking for that stuff, as well as treatments on the sartorius as well.